Welcome to the Yosan University 39 Gen podcast. I actually have a really, really awesome guest with me today. Would you like to share with people who you are a little bit and what you do?
Well, I'm Dr. Judith Orloff, and I'm a psychiatrist, an empath, an intuitive healer, and I have a private practice in Santa Monica, very close to Tao. And Tao has been my acupuncturist for many a year, somebody who I turn to, and love and trust. So I'm very happy to be here on your podcast, and I'm excited about speaking at the event. And I have my latest book is The Genius of Empathy. And this is what I've been on book tour for. And I look at empathy as the secret to healing and the medicine the world needs.
I love that.
Whatever the healing process you're going through, empathy must be part of it.
What inspired you to write this book?
Oh, my deep desire to contribute and help people get along better and help heal themselves, when so many seem lost now and people are trying to find their way and they're experiencing all kinds of health problems that many have mysterious symptoms and so in order to reconnect with yourself, to have good relationships with others, and also help the world if that's what you are so moved to do, even in your meditations, to help the world through, the way you meditate. Empathy is the key.
Yeah, I find earlier in my career, I taught children. And, one of the things that when you get two children that get upset with each other, one of the things that as a teacher you have to do is to sit them down and sit there and try to help them see the other person's point of view and to really feel it and experience it. And when you can do that, it's amazing that these walls come down. These walls come down, and these walls come down for themselves. They soften themselves. They heal internally. There's this transformation that happens when that empathy is introduced into the situation. So it's such a beautiful thing. But what are some of the main points you'd like your readers to take away from your book?
Well, I'd like you all, no matter where you are today, whether you're suffering, whether you're lost, whether you don't know what's going on, or whether you do, have a direction, but would like to have a deeper one. I wanted to present this book as a way to do that. And how do you do that? I've divided it up into healing yourself, healing your relationships, because many, empaths and many healers are into connection and relationships, but sometimes it's hard to make them as magnificent as they can be in terms of communication skills.
Right.
And so I present a lot of communication skills. What do you do if you're arguing with somebody and where does empathy come in? Or if somebody has a different point of view than you, which is so big in our culture today.
Yeah.
It's so hard for people to accept other points of view. It's just still amazes me that, they look at people with different points of view as the enemy, which, and even if you don't, like one thing I present in the book, if you want to tap into empathy, you have to get used to talking to people with different points of view. You can't just be with the choir all the time, because that's easy for people you like to have empathy with them. But what about people you may not like, or you may not disagree, you may disagree with? I mean, even if you're talking to someone you disagree with, instead of your energy shifting to be nasty and judgmental and quiet and terse, what people do when they're around, people they don't like, to just recognize I'm with somebody, I don't particularly care for, but I can still, have empathy for them. How? You can say something like, I heard what you said and I'm going to give it some thought. And that's it. You're not getting into an argument, a confrontation, and you're giving them a gift. I heard you. And believe me, this is not a gift that people get very often, especially if they're used to this, confrontation. And so just simple communication skills like that. And also, if you really want to get into empathy, you have to get used to tapping into your own energy and your own knowing your own energy field. So how you carry your energy and what you want to give to people and how open you want to be versus, how, closed you want to be, because that's a choice. How you hold your energy is up to you. And it's neither right nor wrong. It's just what your conscious, accountable choice of whether you want to hold your energy big around people that would attract them, or hold it more inward, which maybe you don't want to talk to people. But you have to learn, part of empathy is learning to work with your energy and making conscious choices about who you want to be energetically. So you're not just walking around with a super large energy field, attracting all these kinds of people who are telling you all kinds of things that you don't want to hear about. But you don't put two and two together that maybe if you just take a breath, bring your energy in, come to the heart in the center, and you'll be a bit more invisible. And that's important to do for you in terms of your own empathy, because I have so many patients who are empaths and they always want to heal people and help people. And if somebody comes up to them and starts telling them a sad story, they want to do something. And you can't live that way if you're an empath. You have to learn how to set boundaries. So part of what I've written about in The Genius of Empathy is how do you set boundaries from an empathic point of view? Where you're saying a no, you're saying a positive no. I'm sorry, I can't do that. I'm sorry, I can't listen for 2 hours. I don't have it right now. And but you can say it in a, the way your eyes are is important because energy comes from your eyes, and the way you hold your posture. If you have a very loose and nice, friendly posture, and you're saying, "I'm so sorry, I can't do it." That's it, and make your empathic responses short, because many empaths make the big mistake of, as they want to people please, that
Yeah.
they go on this long thing about apologizing for why they can't do something. And I don't suggest you do that. You can be very clear. I'm so sorry. I can't do that right now. And you could be giving them a gift of your energy as how you say it, because you're caring about them. You're not, disliking them or hating them. You're not focused on that. You're focused on, no, I can't do it. But giving them, you're nice about it, basically. And your energy is nice. So it's like a positive no. And that's important for empaths who feel so discouraged about the world, and they're taking on all the world's energy now, and they're exhausted and they have various symptoms. And it's okay for you all to say no to people, and that's what we'll talk about in at the talk. We'll talk about, how do you say no? How do you
Yeah.
do this without feeling guilty? How do you do this and be in your power, and still, communicate something nice to the person you're saying no to? So it's a dance. It's a very elegant dance that you have to practice. And with my patients, I send them out on homework assignments where, let's say, they're particularly have a hard time expressing their own needs, as that's true with empaths. And we practice in my office, and they can't get it out. They can't.
Mhm.
Whatever that you can do it, and they can't get it out, and then finally they get it out, and it's really nice, that they're able to say, I this is what I need, and it might not go along with what you need, but this is it, and to say it nice. And then I send them out to practice with people after we practice together. So it's good if you're wanting a new communication style that's more like the one I'm talking about, where you have limits, what your energy is doing, whether it's out or whether it's in. That it's not appropriate to absorb everyone else's problems and needs, because it won't help you, it won't help them. You'll have two miserable people then instead of one. And so you don't want that.
What are some of the positives and negatives of being an empath?
Oh, the positives are that you're very intuitive. You're able to connect to people. You're able, and I go through all this in the book, and there's a 20 question
It's awesome.
self-assessment test that you can take to see if you're, how much of an empath you are, or if you are an empath. So you're intuitive, you connect to people, you connect to nature,
I love
you
that.
connect to humankind. You don't feel that it's us versus them. You feel the unity of all sentient beings. Um, Really, it's not that hard for empaths to feel that. It's not a matter of debate. It
Right.
just is. And the challenges are sometimes you could be an emotional sponge and you
Right.
take on other people's stress and you take on other people's problems, or you listen to the world state and you take on the suffering of everyone, or you take on the suffering of animals, you take on the suffering of of homeless. You just can't do all that. It's, I understand the motive behind it, and I respectfully say it's really none of your business to do that. Each person has their own path. Each person has to walk their own path. You can send them loving energy as you go by, which is much more helpful than you absorbing whatever it is they're going through. But it's like, good luck, fellow human. Good luck. I send you some good energy, and that does a lot. Even when you don't know somebody, you see someone suffering. I send you something nice, but I don't absorb what you're struggling with. That's what I teach, is how to be with people and send them something nice if they're struggling, but not take on so much. There's a chapter on healthy giving, which I think is so important for healthcare practitioners, for patients, for everyone, to learn healthy giving versus codependent giving, where codependent giving is where you're just overly focused on somebody else and trying to fix them and what's wrong with them. Are they in pain? Are they okay? Should I check with them? Just they too much. Just too much to do with them. And how do you know when it's too much? And what would healthy giving feel like? Healthy giving is when you give not out of obligation or that you feel like you need to heal the world, but I see that you need a little, I don't know, a little push of some sort.
Yeah.
I could give that to you, and just nice, just very low key and nice. And but you feel good, you feel nourished by it. You don't feel drained and depleted and miserable from all this giving, and you don't smother people as many times codependent givers just smother,
Yeah.
too much. I mean, I've seen them working in hospitals, where they're, I call them super empathic people, where they super givers, where they just give, 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 and they're really good at helping certain people. Like, I had a patient who was going through chemo, and she had a super giver who was helping her, and she got everything done, and she was really grateful. But then on the other hand, they can be very smothering. How are you doing, honey? Are you in pain? Oh, a little pain, a lot of, I mean, just nobody wants to be talked to that way. It just makes the person nervous. But they smother people with goodness. They try. So
It's
you have to
true.
know. Yeah, I know. And if that's you, don't be down on yourself, please, everybody. Just everything is a learning, and everything is a healing. And I know, with acupuncture, with herbs, with any kind of body work, it's about self empathy. There's a chapter on self empathy, and it's about tuning in to the most calm, healing, supportive energies that you can. And that's what empathy gives yourself a break. You say to yourself, that was a hard situation today. You did fine. You did the best you could. That's it. As opposed to, oh, I should have, would have, could have, and beat, beat, beat. But the empathy is more, it was hard. That's okay. And you're hurting right now, but let's see what you can do to come back to yourself again.
I love that. And I love that. And it's awesome because I feel like as a student who studied at multiple acupuncture schools, I finally settled at Yosan. And one of the reasons I love Yosan and the tradition from Dr. Dao and Dr. Mao is that there is this foundation of chi cultivation, and the basic beginning is you need to learn to heal yourself. You got to learn to nurture your own energy, to take care of your own energy, to take care of your own space before you even go near someone else. Because if you don't have that self empathy, if you don't sit there and go, I'm feeling a little sore today. What is that? What is going on with me right now? It's hard to go in and be full for someone else. And I see this as a parent with my little 8-year-old. If I'm not at 100%, it's hard to be there for her. It's hard to be present for her, or she might take so much and I feel exhausted, and so
Mhm.
there is the importance of giving yourself that self-care.
Absolutely. And go, for those who are identifying with this, and many do, go right to the chapter on self empathy. I loved writing that chapter because it's so relevant. And I've spoken to, so many of my friends who've been healers and therapists over the years, and we say, why is it so much easier to have empathy for our patients than
Right.
ourselves? It's just a common dilemma. It's just easier. It's human nature. It's easier to help someone else than yourself. It's harder to help yourself, but you want to do it. And you want to make a vow to yourself that you'll do it until the end. You're going to
Yeah.
make this a lifetime practice because it will only serve you. And if you're not going to do it, um, it's going to be a mess, really, because you're going to be beating yourself up so much that you're going to make yourself miserable and deplete your neurochemicals and increase the stress hormone and not work with the vagus nerve because you'll be beating yourself up so much. So you're not working with the peace and harmony hormones in the body. The lack of self empathy just creates a stress response and a trauma response. All right. But
Yeah.
if you're working with self empathy, you can really go through anything because life has its ups and downs. There's no way around it. It just does. It doesn't stay up all the time, doesn't stay down. So it's a sine wave, it changes. And so throughout this ride, you want to be nice. You want to treat yourself nice.
Right.
You don't want to make the situation worse.
Oh, so true. Well, for a lot of the students at Yosan, the question, because they're going to be going out, and I think a lot of people that are drawn to acupuncture are I'm not going to say they're just naturally intuitive, but a lot of the students that I met were very empathic and very
Oh,
much
yes.
much going down that path. And you have to be, when you're doing the diagnosis with Chinese medicine, where you put your hands on and you are feeling the pulse right there. You start off at this place of empathy, of feeling what's going on with them, instead of just, all right, talk about your symptoms, which is important, but that's also, you take this time. And I've been with acupuncturists that spend 15-20 minutes just feeling the pulse, settling into that place. My question is this: how can people use empathy with others without really taking on their stress? What are some of the things people can do to have that boundary?
Yes, well, that's the key, isn't it? To be a healer with longevity, you want to do it
Yeah.
for a lot of years and grow and develop. You can't be taking on your patient's stresses. It just won't work. And so, no, I'm really clear about that as a psychiatrist. And so, when I see patients, I usually have it all focused in one time, where I go from one to the next, but I don't have too many because that burns me out. I don't enjoy it anymore if I have too many people, but I like to have
Yeah.
the person, the space, the clearing of the energy, the person, the space, the clearing of the energy, so that I feel good doing it, and that the other patients who are pretty sensitive usually don't pick up the energy of the previous ones. So that's, and I work with healthcare practitioners. I supervise residents at UCLA how to bring empathy into their patient care. And so to not absorb, you number one have to have it in your head. It's not a good idea to absorb. It doesn't make you a better healer to absorb. It makes you a worse healer. You don't want
Mm.
to do that because then you're putting yourself through undue stress and it's not helping the patient. And so you want to start from a very centered place When you work with patients, I look at patient work as sacred work. And so I get myself in a good position. I set aside my problems, whatever I'm going through in my personal life or whatever that is occupying my mind. I set it all aside. So I really do. And I've done it for years. And just so I could be with you 100%. And not in an intrusive way, but just in a very light way. Now, like Tao does it. Tao has a master, he's just,
So true.
Yeah, right, right. So, you want to be that kind of practitioner for your patients because that automatically starts the healing process. But when they start up, let's say, they have an intense depression or intense anxiety, or they're going through physical pain, and you're open and you're there, and suddenly you notice that you're getting triggered by certain
Mm-hmm.
things. And I've always looked at triggers as something to look at in my own healing, as something, why am I being triggered here? And I really take it seriously, not to work on at that moment, but just, isn't this interesting? I'm being triggered by, I don't know what, anything. I'm getting triggered by, uh, there's so many things I could be triggered by, you know.
Right.
But not really. Actually, I've worked a lot with myself because I believe in that as a practitioner. Because I like to work on myself. One of those people. I love
I
to
love
work
it.
on myself. It's a lot of fun, and it isn't always fun, but it gets you to a place of freedom. And so, I look at that as later. I'll do the work later, but in the meantime, I try and center myself. I try and keep a loving detachment from them. I talk to myself and I say, this is not mine. This is theirs. You want to be there for them. And you'll deal with your trigger later. And you want to come from your heart. When you're listening, there's a chapter on empathic listening. How you listen to someone is very important. No, you don't want to be intrusive with your eyes, working with the energy of the eyes, working with the energy of the voice, working with the energy
Mm-hmm.
of the body. It's how you hold yourself, how you listen, the words you say. It's like a symphony. No, it's
Yeah.
you tune into yourself and you create this very positive place for your patients, but you don't see it as your job. And this, you have to be very clear to take on their pain. It's just not your job. Nobody. It's none of your job. It's not going to help anything. And I think as healers, I know both my parents were physicians, and I have 25 physicians in my family. So I was brought up around a lot of medicine and a lot of talking. And I think in the old days, they kind of felt it was their job. They wanted to, they were altruistic. They wanted to give everything, and it's just so tricky if you try and do that, because some people turn to alcohol, some people turn to drugs, because it gets to be too much. You can't
Yeah.
take on everybody's listening. If you're a practitioner, you can't take on other people's pain and have it be helpful, or have a longevity as a healer. You just can't do it. So I'd like you to get used to the idea that that's not a good idea to do that, and be able to accept that you can give more and more powerfully and create an environment for your patient's healing if you don't do that. Where
Yeah.
you can feel someone in pain. Like if you're in pain and you start crying, men cry,
Mm-hmm.
and
For
women
sure.
cry, everybody cries. So crying is a wonderful thing, and it's a release. And I
Mm-hmm.
remember when I was at UCLA resident in psychiatry, they did a video, of all the residents, and and whenever someone would cry, I would always smile, and they would say, "No, no, no, you're not supposed to smile when people cry," and I'm like, I'm happy for them. It's a
Yeah.
breakthrough. Usually, unless it's a horribly depressive cry, which is a different. You learn to know to identify different kinds of cries from your patients,
Mm.
but mostly it's a positive breakthrough. I mean, even in the substance of the tears, you have stress hormones coming out of the substance of the tears, so you're releasing stress hormones. So I smiled, and they said, "No, you don't smile," but I've always smiled when my patients cry, so that's just how I do it.
That's awesome. The one of the things that you pointed, two things that you pointed to that I just want to touch on that I felt inspired by were We have, everyone has the things they have to process, and to be there for them as they are in that process is almost more powerful than doing it for them. I think about, for my daughter, she had challenges learning to tie her shoes and wanted to wear Velcro shoes for the longest time. And so finally she was like, "Daddy, can you tie my shoes for me?" And I said, "No, but I can be here with you while we tie them together, while we
Yeah,
work on this skill. Because if I keep doing it for you, then you're going to feel great as long as I'm around. But the second I'm gone, you're going to have a challenge because you're not going to have that skill internally." And it's one of the beautiful things I find with acupuncture is you sit there for the healing process, you put the needles in, and you leave, you step out and allow them to
yeah,
rest in the room and create that
yeah,
self-healing
yeah.
and in that space.
That's a great metaphor to also use with patients when they're going through something. I always teach my patients empathy. That's a big thing. That's part of therapy, is learning how to show yourself empathy and show other people empathy, just as a higher trait and a way to be and a way to heal. Because when you're showing at yourself empathy or others empathy, what that happens is you're triggering the heart energy to open, and your heart then starts spreading throughout your chest and throughout your body and beyond your body, and you're creating the healing energy then. And empathy is the trigger that starts that. Just so you feel empathy with someone, and then it spreads all around your body. And there's something I write about in The Genius of Empathy called the Mother Teresa effect. And what that is that it's been shown scientifically that if you witness an empathic act, and I were to draw your blood then, what it would show is that your immunity would grow stronger, your stress hormones would go down. I mean, very quickly by just witnessing it. You go, heart energy opens and stress hormones go down, and the immunity goes up just by watching, just by watching the Mother Teresa effect. And I know what that feels like, because I look for acts of empathy in my life, and I like watching them. And I see them like at the gym. There's a lot of, with the older people come in,
Just by watching this
just
empathic
by
act.
watching somebody who is giving an empathic act. Like I saw in the gym, I guess the wife brought the husband to work out, and I was partially paralyzed, and so she had to lift him into the machine, the just in the seat, and the way she held him, and lifted him and put him down, and I was like, oh, what a gorgeous feeling she's giving to me, and just being able to watch this. And
Right.
I go, wow. What, I mean, it was a beautiful, it wasn't just clunking him down and putting him in. It was like, oh, it was a beautiful, but not over. It wasn't overly. It was just beautiful, So you might want to look for that in your life, just around, if you can get out of your head. And empathy means, and that's what, I talk about a lot in here. It means getting out of your head and into your heart.
Love that. I love that.
You can't think your way there.
And you're doing a workshop. Can you tell me a little bit about what will be learned?
What we'll be learning is how you could bring empathy into healing to increase your connection with patients, at the same time not absorb their energies, to be able to take care of yourself as a healer and practice self-care and not overgive, and practical ways of how to bring empathy into your life. I mean, I invite people to bring in their questions, and how do you do it? How is it hard for you? How does it work? When does it get to be too much? It's a dialogue about empathy as a healing technique, and how you can incorporate it with your patients and in your own life.